Intramuscular injections are administered into the muscular layer of the body, which lies beneath the skin and subcutaneous layers. Absorption is more rapid by this route than through the subcutaneous route. This is because there are more blood vessels located in muscle tissue. The length of the needle for an IM injection varies from 1 to 3 inches depending on the size of the patient. A 1 inch to 1 1/2 inch needle is typically used for an average-sized adult. The gauge of the needle ranges from 18 to 23 and depends on the thickness of the medication being administered. Thick and oily medications require a needle with a bigger lumen. The medical assistant is often responsible for administering intramuscular injections in the medical office. Medications that are administered through the IM route include most immunizations, antibiotics, vitamin B12, and injectable contraceptives and corticosteroids. Intramuscular injections must be administered at specific sites to avoid puncturing large nerves or blood vessels. You should practice locating these sites to become familiar with them. The medical assistant will show you how to locate the 4 sites used to administer an intramuscular injection, starting with the dorsogluteal site. The dorsogluteal site is used primarily for adults. In an adult, the gluteal muscles are well developed and can absorb a large amount of medication. The patient should lie on the abdomen with toes pointed inward to aid relaxation of the gluteal muscles. The medication is injected into the upper outer quadrant of the gluteal area. To locate this site, palpate the greater trochanter and the posterior iliac spine. Draw an imaginary line between these 2 points and administer the injection above and outside of this area. The dorsogluteal site can also be located by dividing the buttock into quadrants. The site is located in the upper outer quadrant approximately 2 to 3 inches below the iliac crest. The medical assistant must be extremely careful to maintain the proper boundary lines to avoid injection into the sciatic nerve or the superior gluteal artery. Next, the medical assistant will show you how to locate the deltoid site. The deltoid site is easily accessible when the patient is sitting or lying down. The site is small because major nerve and blood vessels surround it. Expose the site completely. Remove clothing with a tight sleeve if it cannot be rolled up. Palpate the lower edge of the acromion process. Place 4 fingers horizontally across the deltoid muscle with the top finger along the acromion process. The injection site is located 2 to 3 finger widths below the acromion process, which is about 1 to 2 inches below the acromion process. Since this site is small, do not inject more than 1 cc into this site, and do not give repeated injections here. This prevents trauma to the muscle tissue, which could damage it. The vastus lateralis site is particularly desirable for infants and children younger than 3 years old whose gluteal muscles are not yet well developed. It is easier to give an injection in the vastus lateralis if the patient is lying down, but a sitting position also can be used. The area is bounded by the mid-anterior thigh on the front of the leg and the mid-lateral thigh on the side. The proximal boundary is a hand's breadth below the greater trochanter, and the distal boundary is a hand's breadth above the knee. To locate the vastus lateralis site in an infant or young child, divide the mid-anterior thigh into thirds. The injection is administered into the middle third of the thigh. When administering the injection, the thigh is grasped in order to compress the muscle tissue and stabilize the extremity. The ventrogluteal site is considered an excellent site for administering an IM injection because it is located away from major nerves and blood vessels. The patient may be lying prone or on one side for this injection. To locate this site, palpate for the greater trochanter, the anterior superior iliac spine, and the iliac crest. If injecting into the patient's left side, place the palm of your right hand on the greater trochanter and your index finger on the anterior superior iliac spine. Spread your middle finger posteriorly as far as possible away from the index finger to touch the iliac crest. Reverse the hand position for the other side. The triangle formed by your fingers is the injection site. Now that you are familiar with the intramuscular injection sites, the medical assistant will demonstrate the procedure for administering an intramuscular injection. Sanitize your hands before you begin. Prepare the injection. The physician has ordered a tetanus toxoid injection. The injection is to be given in the deltoid site. To prepare the injection, you will need the tetanus toxoid vial, a hypodermic syringe with a 1-inch needle, and an antiseptic wipe. For this injection, the medical assistant is using a needle that retracts into the syringe when a safety mechanism is activated. Prepare the injection and take it to the patient's room. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure and the purpose of the injection. Locate the deltoid injection site. Ask the patient to pull up his sleeve to ensure the entire area is exposed. Palpate the lower edge of the acromion process and place 4 fingers horizontally across the deltoid muscle. The site is located 2 to 3 finger widths below the acromion process. Prepare the injection site. Cleanse the area with an antiseptic wipe. Use a circular motion starting at the injection site and moving outward. Do not touch the site after cleansing it. Allow the area to dry completely. If you don't, the antiseptic may enter the tissue when the skin is pierced, resulting in irritation and discomfort for the patient. Apply gloves and remove the needle guard. Position your non-dominant hand on the area surrounding the injection site. Stretch the skin taut over the injection site. This permits easier insertion of the needle and helps to ensure that the needle enters muscle tissue. Hold the barrel of the syringe like a dart and insert the needle at a 90-degree angle to the patient's skin. Insert the needle quickly and smoothly with a firm motion to minimize tissue trauma and pain. Insert the needle to the hub. Hold the syringe steady and pull back gently on the plunger to determine if the needle is in a blood vessel. If the medication intended for intramuscular administration is injected into a blood vessel, the result is faster absorption of the medication. This may produce undesirable results. If blood appears in the syringe, withdraw the needle, prepare a new injection, and begin again. Inject the medication slowly and steadily by depressing the plunger. Activate the retractable needle on the syringe by firmly depressing the end of the plunger. This causes the needle to automatically retract from the patient's tissue and into the syringe. Place a gauze pad over the injection site. Apply gentle pressure to the injection site with the gauze pad. Gentle pressure helps distribute the medication so that it is completely absorbed by the muscle tissue. Avoid vigorous massaging because it could damage underlying tissue. Properly dispose of the needle and syringe in a biohazard sharps container. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, the name of the medication, the lot number if required, the dosage given, the route of administration, the injection site used, and any significant observations or patient reactions. Stay with the patient to ensure that he is not experiencing any unusual reactions. If the patient experiences an unusual reaction, notify the physician immediately.